I feel like I'm in the presence of friends. And I look around, there's a lot of diversity among us, and those listening virtually, I can only imagine the diversity of over 5,000 listeners, right? Anytime that you look at each other and see that there's differences and unique abilities, I recognize those differences and like to find the collective things that all make us one. You know, in all of the things that I've done in my career or sports, I've tried to do my best, and I bet that each one of us in this room and listening is the same way. We just strive to do our very best with what we know and what we can do. And probably, like me, I like to study the masters, those who have gone before. What did they do? What was their path of success? And I find that there's two things that they're obsessed with: basics and fundamentals. So I've taken the simplicity approach in everything that I do. And I've got 18 years of all of those things and 1,000 stories. But there's really only one story to be told. It's not about me. You see, I was working at Next Level Practice, building programs, and we had just finished outlining the $1 million Airway program, training doctors and teams to implement Airway. We'd gone through the course outline, and I was in a final content interview with Dr. Michael Gell. And we were discussing the curriculum around identifying sleep-related breathing disorders in children. It was all awesome. I was geeking out on all the material until we started going over the signs and symptoms in the mouth of the age of a child that was the age of my daughter. And I stopped for a second, and it's like I'd been slapped in the face with information and answers that I've actually been looking for and didn't realize the answer would come like destiny on that day. You see, my daughter was off the charts, off the growth charts. And look at me, I'm 5 feet tall. Okay, I claim that I'm 5'1" on my driver's license, but my daughter was off the growth charts, and I'm not talking off the growth charts, I'm talking off the growth chart. She stopped growing, and we didn't know why. She was taking DNA tests and bone age tests to figure out what was going on, hormone levels, you name it. At the same time, she was having uncontrolled asthma to the point where we would literally wake up in the middle of the night and check on her to make sure she was still breathing because we've literally almost lost her. She was struggling in school. Our nights were filled with frustration, helping her with her homework. And I was banging my head against the wall, wondering what was I doing wrong as a mother, because I didn't know why my child couldn't read the word little at her age. But the worst thing is that her confidence was shot, and that killed me as a parent because I didn't know what was happening. I took a big sigh of relief. I had the answers. I knew that there was a pathway, and I got to give myself a little bit of break, not beating myself up as a mother. You know that all of us mothers do that, right? But the thing that really kicked in is that I was a licensed dental professional. I've been looking in mouths for the time 16 years. Why hadn't I seen this before? And I didn't feel like I was a, just out of school fresh hygienist. I was teaching classes on oral systemic health. I was speaking case acceptance. I was going through advanced curriculum, but I didn't see that. And if I missed it in my own family, how many other licensed dental professionals, dental assistant, and even office team members haven't recognized those simple things we just needed to pay attention to? So this up here is a call to action of all of the hygiene departments that are building their programs just around perio. I love managing periodontal disease and the programs. That was my passion for a long time. But until I saw a new light of restricting the focus of hygiene programs in dental practice is just not acceptable anymore. That the role of the dental hygienist as a natural investigator is really the only way to go at this point. Because if I was to get my daughter care, I not only had to figure out in my area who could treat her on that pathway, I had to become the level of professional like a PA is to an MD. I had to talk to the doctors in a partnership and discuss her care and identify what are the anatomical things happening and what treatment pathways should we take at what phase. Because I did that and because I had the confidence in my own knowledge and my own abilities, and I didn't think that I needed to know how to do everything, I just needed to know what was the next conversation and what was the next step. To go to a doctor and say, this is what I observed that's going on, and these are the dots that I'm putting together. What do you think? Together in partnership, we got her into treatment and therapy. Within 6 months, she grew 4 inches. Her education continued. Yeah, we still had some table discussions, a little bit of frustration. We worked through it, and her academics soared. Her asthma became under control, but best of all, man, the emotion's gonna kick in here, guys. I saw her stand on stage in confidence and sing beautifully an Italian aria in an audience of 500 people at the elementary school because she knew she could do that. To stand there and watch your child go from not even being able to speak and communicate with friends to stand on stage like that, priceless. So here we are as licensed dental professionals, working on our businesses, working on our professions, having families, and trying to find balance in all of that. Look, anytime that there's kids involved, or like we heard from Dr. Martin, the statistics are telling us that 6 out of 10 patients that we see have some type of sleep-related breathing disorder. That's teens, that's adults, and that's children. So when hygienists are going through the periodontal exam and seeing bilateral recession, seeing mandibular torus, seeing a thickened alveolar arch, macroglossia, scalloped tongue, fissured tongue, what does that tell you? That tells you that you can stand in confidence and that you are elevated to the role of chief investigator for the practice and to manage that case in partnership with a dentist and also with the physician. Best of all, you get to observe the case as the patient comes back time after time again and be a keystone player in the efficacy of the case. That is the key, the efficacy and following the case. The hygienist's role in airway management is not solely in myofunctional therapy. Yes, a huge role, but within the operatory, you're not changed that operatory and the procedures anymore. You're not. I'm not here to have my story be so unique, because the truth is, and the reason why all the letters after my name are not included in my bio, is because my story should be like every other story that is told. We need to hear more stories just like mine, and it'll be so commonplace that it would become the new norm to have a hygienist elevated, practicing at the level in partnership with a dentist, just like a PA and an MD. It's time.